Time for your health check. Kids ages 5 to 11 can now start getting COVID vaccines. This little boy, I'm sure you've seen him, he's among the first children in the country in that age group to get the vaccine, not in Texas, but this happened not long after the director of the CDC gave the green light last night. Now, kids will only get 1/3 of the adult dose. I've mentioned this to you before. Early studies found the vaccine to be almost 91% effective in preventing symptomatic illness in young children with only mild side effects. So those include a sore arm at the injection site, headaches, and fatigue. Studies found no cases of myocarditis in this clinical trial. Myocarditis, again, is a rare heart inflammation seen in some young men, but it is most common between ages 12 and 29. There's also several types of myocarditis, as I learned in the ACIP meeting yesterday. So, for those of you who are waking up going, okay, how do I get my child vaccinated, Sonia? That's all I need to know right now. Just like with the adult vaccines, you're going to be able to get the children's shots at drugstores like Walgreens and CVS. Walgreens online scheduler is set to open today with shots expected to go out on Saturday. CVS says the vaccine is going to arrive in some stores later this week, so you can look for their online schedule to open then. I understand that Mark used Walgreens to sign up this morning. So how did that go for you?
Yeah, it was super simple actually, and I checked both Walgreens and CVS's online scheduler were up and running as of this morning, but it just went the same way that it worked to get adult vaccination schedules. You put in all the information, they give you some locations, some times and all that, and they also schedule your second dose as well. I know some folks are concerned about making sure that their kids are fully vaccinated by Christmas time when they're going to be around extended family members. So if you're trying to plan for that, you can get both doses scheduled, which I thought was pretty helpful. So I did see those, Sonia, when I was on there. You refresh the screen, all of a sudden about half the appointment availability diminishes. So looks like I'm not the only one up early this morning trying to get those scheduled.
Well, and I think that, look, we've talked about this before, right? The people who know that they want to get their kids vaccinated are in line and they are ready to go. And there's still a lot of people waiting to see, which is understandable, as the doctors and researchers also acknowledged yesterday during that 6.5-hour meeting. So thanks, Mark, for that perspective. And, despite promising data from these clinical trials that I keep talking about, a recent survey shows almost 2/3 of parents say, look, I'm not going to get my kids vaccinated right away. I do want to share an exchange that I had over Twitter with Jerome Adams. He was the U.S. Surgeon General under former President Trump. He was in town last night speaking at SMU and gave really a great talk. So I asked him if he agrees with the CDC's decision, since I had him right there, right? And if he would get his kids vaccinated. He's got 3 kids. 2 of them are old enough to have already been vaccinated. So here's his reply to me. I agree with the CDC director. Vaccination thumbs up for ages 5 to 11. Everything has a risk and benefit in life. Based on my review of the data, the benefit outweighs the risk for most 5 to 11-year-olds. We will be getting our 11-year-old vaccinated.